PEG 400 hypromellose glycerin drops are used to relieve dry, irritated eyes caused by various factors such as wind, sun, heating/air conditioning, computer use/reading, and certain medications. It contains ingredients like carboxymethylcellulose, dextran, glycerin, hypromellose, PEG 400, polysorbate, polyvinyl alcohol, povidone, or propylene glycol. These drops work by keeping the eye moist, protecting it from injury and infection, and reducing symptoms of dry eyes such as burning, itching, and the sensation of something being in the eye. It is recommended to use these drops as directed by your healthcare provider, usually a few times a day. The best time to take these drops may vary depending on your individual needs, so it's important to follow your doctor's instructions. When using PEG 400 hypromellose glycerin drops, always follow the directions on the product package. If you have any questions, ask your doctor or pharmacist. Do not use the drops if they have changed color or appear cloudy, but it's okay if they have a milky appearance as long as the color hasn't changed. Some eye drops need to be shaken before use, so check the label to see if this applies to your product. You can use the drops as often as needed, while ointments are typically used 1 to 2 times daily as needed. If using an ointment once a day, it may be best to use it at bedtime. To apply the drops or ointment, wash your hands first and be careful not to touch the dropper or top of the ointment tube to avoid contamination. Tilt your head back, look up, and pull down the lower eyelid to make a pouch. For drops or gels, place the dropper directly over the eye and squeeze out 1 or 2 drops as needed. Look down and gently close your eye for 1 or 2 minutes, then apply gentle pressure near the nose to prevent the medication from draining away. For an ointment, hold the tube directly over the eye and gently squeeze a small strip into the pouch. Close the eye and slowly roll your eye in all directions to spread the medication, then blot away any extra ointment from around the eye with a clean tissue. If you are also using another kind of eye medication, wait at least 5 minutes before applying other medications. Use eye drops before eye ointments to allow the eye drops to enter the eye. If you wear contact lenses, remove them before using most kinds of eye lubricants. Ask your doctor or pharmacist when you may replace your contact lenses, as some eye lubricants can be used while wearing them. And remember to tell your doctor if your condition lasts or gets worse after 3 days. When you first start using PEG 400 hypromellose glycerin drops, you may experience temporary blurred vision, as well as minor burning, stinging, or irritation. If these effects persist or worsen, it's important to notify your doctor or pharmacist as soon as possible. If your doctor has prescribed this medication for you, it's because they have determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. However, it's important to seek medical attention immediately if you experience any serious side effects, such as eye pain, changes in vision, or continued redness and irritation in the eyes. While it's rare, a very serious allergic reaction to this medication can occur. If you notice any symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or difficulty breathing, seek medical help right away. It's also important to note that this is not a complete list of possible side effects. If you experience any other effects not mentioned here, be sure to contact your doctor or pharmacist. As always, if you have any concerns about the side effects of PEG 400 hypromellose glycerin drops, don't hesitate to reach out to your doctor for medical advice. Before using these drops, it's important to check with your doctor or pharmacist if you have any allergies to the ingredients. This product may contain inactive ingredients that could cause allergic reactions or other issues, so be sure to discuss this with your pharmacist. If you have any health concerns, it's best to consult with your doctor or pharmacist before using these drops. After applying these drops, you may experience temporary blurred vision. It's important to avoid driving, using machinery, or doing any activity that requires clear vision until your vision has returned to normal. It's important to be aware of how PEG 400 hypromellose glycerin drops may interact with other medications you may be taking. It's possible that these interactions could affect how well your medications work or increase the risk of experiencing serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as any herbal products, and share this list with your doctor and pharmacist. It's crucial to have their approval before starting, stopping, or changing the dosage of any medicines. Always consult with your healthcare professional before making any changes. If this medicine is swallowed, it can be harmful. If someone has taken too much and is experiencing serious symptoms like passing out or difficulty breathing, it is important to seek immediate medical help by calling 911 or contacting a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Some products contain preservatives that may damage contact lenses or cause irritation in persons with allergies. For more information, check your product package or talk with your healthcare professional. These drops are used to relieve dry, irritated eyes. They work by lubricating the eyes and helping to maintain moisture. To use these drops, tilt your head back, look upward, and pull down the lower eyelid to make a pouch. Place the dropper directly over the eye and apply the prescribed number of drops. Gently close the eye for a few moments, and then blink to spread the medication evenly. Use this medication regularly to get the most benefit from it. To help you remember, use it at the same times each day. Do not use more of this product, use it more often, or use it for longer than prescribed. This medication, PEG 400 hypromellose glycerin drops, is typically used on an as-needed basis. It is important to follow the instructions of your healthcare provider regarding the dosage and timing of this medication. When using PEG 400 hypromellose glycerin drops, make sure to store them according to the instructions on the package. It's important to protect the drops from freezing. If you're using preservative-free drops from single-use vials or droppers, you should discard them either immediately after use or within 12 hours of opening. Check the product package for specific instructions. Always keep medications out of reach of children and pets. When it comes to disposing of the drops, don't flush them down the toilet or pour them into a drain unless directed to do so. Instead, properly discard the product when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the best way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.